As things continue to get back to normal, a lot of people are anxious about getting back to pre-pandemic life. It's called reentry syndrome. Now, traditionally, psychologists reserve the term for soldiers returning from a war zone or prisoners being released back home. But my next guest says that reentry syndrome is something we are all grappling with in one way or another. Carmine Pariante is a professor of psychiatry at King's College in London. Professor, thanks for being with us. Before we get to reentry syndrome, I just hear my friends and my colleagues say that I can't wait until we get life back to the way it was, that we can go back to who we were. The truth is that after a year of being isolated and rethinking our lives and all of that, you say that we are not the same. We cannot go back there, right?
Well, absolutely. So, re-entry syndrome is used to kind of describe a situation where we are no longer the people that we used to be before kind of COVID, and the society around us is not the same society that we used to know before COVID. So we are, let's say, not prepared, or some of us have lost the skills, or we just have to slowly gain the skills again.
So what's the syndrome here? Because it sounds a little intimidating when you think we all now have this syndrome we're all walking around with. What is it?
No, absolutely. And I think, the syndrome kind of defines it almost like a medical problem, which of course is not for the majority of people. I think most of us would just simply feel some discomfort and some uneasiness and some anxiety in doing things that before were quite simple for us to do. Go to a crowded place, meet friends, socialize, perhaps even do things like small talking and having a kind of conversation, having physical intimacy. So things that were part of our normal kind of repertoire of experience, of course, is something that many of us haven't not been able to do for a long time. And so we feel some discomfort at the beginning, which we will be able to overcome with some time.
Yeah.
But I think the importance of using the syndrome or the word syndrome is because for some of us, it's not going to be so easy. It's not going to be some kind of general discomfort. So there are people that perhaps have already had mental health difficulties before the pandemic started, or may have developed mental health difficulties during the pandemic. And for these people, of course, the being at home, in some cases, had some kind of protective effect. And now they have to kind of face again the world outside. So for these people, it's going to be more difficult. They may experience actually clinically significant levels of anxiety, fear of being socially awkward, or actually fear of being infected by the virus. Yeah. And in general, just not being comfortable in the society as they used to be.
So what do you do? Do you wait for it to pass? Do you get treatment? Do you reach out to speak to someone?
Well, again, all of this is possible. I think most of us, most people just simply have to face the little discomfort and accept that it will be difficult at the beginning and will just get better with time. And so my first kind of recommendation is that nobody should stay at home anymore just because they feel uncomfortable. They should gently, kindly, with kindness toward themselves, force themselves to do the thing that they used to do. People who are suffering from mental health difficulties, who are experiencing perhaps a relapse in their anxiety, then of course they should be seeking help. Most of us, they just simply not give up.
Well, some people aren't as gentle and kind with the request to return to the crowds. I want you to listen to the CEO of Morgan Stanley here, speaking to members of his industry, some workers there, about returning to the office.
If you can go to a restaurant in New York City, you can come into the office. And we want you in the office.
So, okay, from a physical, maybe spatial perspective, sure, but psychologically, socially, is that a fair comparison?
Well, I mean, first of all, we know the re-entry syndrome is worse if you're forced to go into the new situation, and is worse if you are not in a supportive environment. So, going to a restaurant, especially early on, will be a choice that all of us wants to do to kind of feel better and meet friends. Going to the restaurant is different than going to the office. Going to the restaurant is an element of course, pleasure. Going to the office may be a choice, maybe not. And I think that's something that needs to be taken into consideration. The more supportive we can be as bosses, supervisors, friends, mentors, the more supportive and compassionate we can be with the people around us who have difficulties, the sooner they get better.
All right, Professor Carmine Pariante, thank you so much.